Now, still to come on Good Morning Britain. Well, asbestos was banned 25 years ago, so you could be forgiven for thinking it's no longer a danger. And yet, staggeringly, it kills 13 people every day in the UK. We're speaking to a mum, you just see her there, who has mesothelioma, which is usually linked to exposure to asbestos. And she's campaigning for better education for healthcare professionals to spot the signs more quickly and ensure a quicker diagnosis. It's still, she says, in our schools, in our homes.
You don't know where it is.
And you don't know where it is or how it's affecting you. Yeah, so fascinating.
That's soon. But first, let's get the news, travel and weather wherever you are. Welcome back. Now, 25 years after it was banned, asbestos still kills an estimated 13 people every day.
Extraordinary.
It's extraordinary. In fact, the UK has the world's highest rate of deaths from asbestos-related cancer, mesothelioma.
9 months after giving birth to her son, Emily Jane Scandrett received the agonising news that she has the incurable disease, and she's pushing for better education to spot the symptoms sooner, while campaigners want a national register of public buildings containing the deadly material. Well, Emily, as you can see, is with us now, along with Andrew Payton from the group UK National Asbestos Register. And we also have Dr. Amir to talk through exactly what it all is. Oh, Emily Jane, I'm so sorry that this has happened to you. Tell us how you first initially sort of had a sense that something was wrong and how then it became connected to asbestos.
So I was 5 weeks pregnant when the pain first started, all here. Stabbing, paralysing pain. I went to my doctor, who referred me to the hospital. They carried out tests. They thought it might be an ectopic pregnancy.
Oh, God.
And then during various other trips to A&E, they ruled out gallstones, pulled muscle, and then they just didn't know.
So it didn't spring into your mind?
No.
It certainly didn't cross their mind?
No.
Because presumably you had no sense of, you hadn't worked in an industry where you might have been dealing with asbestos.
No.
You know, how did the link come that this was a cause?
So it wasn't until, throughout the whole of my pregnancy, I was in and out of A&E. I was admitted 4 times into hospital. During a hospital admission when I was heavily pregnant for 9 days, I had a CT scan. Right. The cancer showed on that CT scan, but unfortunately it was missed. So the following month, in the January, I gave birth to Thomas via C-section.
Right.
And then it was just a helpless situation, because I was just being turned away every time I go and see a healthcare professional. They just did not know.
So you had this beautiful baby boy.
Yeah.
You got through the pregnancy and maybe wondering if it was connected to the pregnancy.
Yeah, they've said it was not pregnancy related.
And you still had the pain afterwards?
Yes. So then I was referred for an MRI, a skeletal MRI. That showed right side pleural effusion. I then had an X-ray after that, which at the time they said was clear, but I've recently found out pleural thickening was showing on that X-ray as well. So that's being investigated.
Related to the lung, isn't it?
So it's in the pleural. So that's where the mesothelioma is.
Yeah.
And then it wasn't until September, so all those months later, when I was still in lots of pain, and I just started back at work. I'd 2 weeks after my maternity leave. So my husband said to me, you need to go back to the doctor again. And luckily I didn't see my GP that day. I saw an on-call paramedic called Dave, and he listened to me. And he sent me back to the hospital. They did an X-ray, followed by a CT scan, and then it all just snowballed from there. And so I had CT guided lung biopsies taken, and then I had my mesothelioma diagnosis and that.
So sorry to hear that. How are you now?
Mentally, it's hard.
Oh, goodness. Of course
Just
it's
try and
hard.
stay as positive as possible. And having young children helps, because you just have to get up and get on with life.
Oh, my
But
goodness.
it's having that diagnosis, because I know none of us know how long we've got, but being told you've got this and having that just there all the time is really, I just try my best to get on with things.
Can I ask you, I mean, you're so brave to sit
So
here and you've got a
brave.
wonderful family and your 2-year-olds and you're determined to live,
Yeah.
not just for them,
Yeah.
but also because you want better awareness. I'm going to
Yes,
bring
yeah.
Andrew in at this point. You founded a not-for-profit asbestos awareness. What inspired you to do this? Listening to Emily's courageous account, just tell us why. And why do we not know about this?
Well, I probably, like most people, had thought it was a 20th century problem, but actually it came about from talking with somebody who knows a lot more about asbestos, and then we found out more and more. And
Because I think people think there was a huge shock and scandal 70s later,
Yeah.
wasn't there? Then it got banned.
Yeah.
Lots of people had it removed from homes and offices. And so we kind of think it's gone.
yeah,
So what are you telling us that's different?
well, it hasn't. That's fundamentally it. While it may have been banned in its implementation and usage, it remains in an unknown number, hundreds of thousands of workplaces, well over 1 million buildings in the UK right now.
So you want, just to be clear, a digital database, right?
We want to have, we have this information. This information, every workplace has had a survey that identifies whether it's got asbestos or not. We have this information. It needs to be digitised, made accessible, so that people
QR code, so people can know if they're going into a building which can cause danger.
And presumably it would also help identify it.
Right.
Because if there are a cluster of people reporting cases in an area, it would help people to look for it. Dr. Amir, why does asbestos cause this devastating disease and why is it still out there?
So the way it works, asbestos is a naturally occurring mineral. It's been used historically for insulation in building works. If it's not disturbed, it's relatively safe. Ideally, it shouldn't be there at all. But if it is disturbed through building works or anything, it releases these airborne fibres which settle, we inhale and it can settle in our lungs. Our bodies can't break those fibres down. That causes scarring and cell changes within the lungs, which can lead to this rare cancer, mesothelioma. We need to know, I agree, we need to have this database because patients don't develop this cancer often. Emily's case is slightly different, but often it doesn't develop until 10 plus years later.
For a number of people, this really is a health crisis, isn't it?
It can be thought of that way because
30
we don't...
people a day seems a staggering number.
It is.
Dr. Amir.
Having that database would be really useful because we could then check people's symptoms against where they've worked, where they've been in the past. And 10, 20 years later, they may not know that. So we can then look that up and link the two things together.
Emily, I want to thank you for coming in. I know you were a bit nervous, to say the least, before sitting down. Just help us, if there'll be viewers out there that be a little bit worried but want to find out more. What's your message to viewers about exposure to asbestos? And also, because you've helped me this morning, about hope and carrying on.
I don't want anyone to go through what I did for those 17 months. I don't want anybody to even have this cancer, but I also want the people who are diagnosed with this and their families to know that they're not alone. There is so much support out there. And also that it's not a death sentence as soon as you're diagnosed, because there are treatments. It's not one treatment will suit everybody, but just please don't give up on hope.
Well, you're absolutely... I'm going to squeeze your hand.
Thank you.
Because I'll hug you throughout. You've been amazing, and it's amazing, you know, you'll have helped so many people by what you've said. And thank you.
Thank you as well. Thank you for giving us the opportunity to come on to speak about this.
Good luck.
Thank you.
Really?
Now,
Sorry, please.
No, you can. Just to say...
Yeah, if you've been affected by any of the issues
So sort of...
we've been discussing, you can find advice and support at itv.com/helplines.
Incredible. Now, weather time. You always got the details.